I'm just going to open your gown here just a little bit. And what I'm looking at here is I'm looking for any abnormalities of the skin. I don't see your respirations look nice and even, unlabored, no abnormal depth, no abnormal excursion. They're at 16 as we said before. Now I'm just going to lightly feel. As I feel down your back, what I want you to do is just repeat 99 in each new spot I feel.
99, 99, 99, 99, 99, 99.
Perfect. Now you can stop. I'm just going to palpate the rest of your back here. No abnormalities. Felt or palpated. Tactile firminitis and lungs. Alright, now I'm going to percuss. What this feels like is this on your back, okay? So each new spot I'm going to do that in, okay? Don't be alarmed. Now, I'm going to rather hardly percuss. It's going to feel like this on your back, but don't move. Just try and stay still and tell me if it hurts. Alright, costovertebral angle is non-tender, which means that most likely there's nothing wrong with your kidneys. That's what that's telling us. Alright, I'm going to ask you to breathe in and hold it for me. Let it go. Breathe in and hold again. Let it go. Okay. Now what I'm going to do is I'm going to ask you to do the same thing, but as you let it go, hold it there at the bottom of the breath. Go ahead and breathe in and out. Breathe it all out. Now hold it there. Okay, go ahead and breathe in again and out. Hold it. Alright. Go ahead and breathe normally again. Measuring that, that's about 3 centimeters, which is within normal limits. And that's diaphragmatic excursion. That's what I was measuring there. Now what I'm going to do is I'm going to just lightly feel along your scapular areas here for any lymph nodes, and I feel non-popular scapular and subscapular areas. Now we're going to listen. What I'm going to have you do is lift your arms so that I can listen under your arms as well, okay? I'm going to first do your back and I'll tell you when.
Okay.
Perfect. Now, I'm going to ask you to lift this arm for me. Alright, go ahead and put that arm down. Other arm. Perfect. Go ahead and put the arm down. All the lung sounds are clear to auscultation on the back. Alright, we're going to move on to the front now here. And same thing, I'm just going to look first. What I can see of your chest here. Thank you. Normal, no abnormal masses or spots that I notice. Alright, we're going to begin palpation in the same thing here, okay? As I'm moving down, I want you to say 99.
99, 99, 99. 99.
Alright.
99. 99.
Alright, under the arms and on your front, all clear. Okay. For tactile firminitis. I'm going to also do resonance here. Alright. Everything sounds clear, doesn't it? Nothing abnormal about that. Alright, I'm just going to listen here. We're beginning at the chest, we're listening for lung sounds, but I'm also going to be, as I'm listening for your lung sound, I'm also listening at 5 different particular areas for your heart sounds. And those are the aortic and the pulmonic, Erb's point, the mitral and the tricuspid areas.
Okay.
Which just tells me how well your heart's working. And as I'm under here, I'm going to feel for your PMI, which is the point of maximal impulse, which is where your heartbeat should be felt the hardest, and it is there, down at the fourth midclavicular line on the left. Well done. Clear heart sounds S1 bladder at the base, S2 bladder at apex. Your lung sounds are cleared auscultation. So what I'm going to do now is we're going to move on. We're going to go ahead and go on to your abdominal area. Okay. So if you want to just lay down for me. Alright, what I'm looking for here is any abnormalities of the stomach. I don't see any, no obvious masses or anything. Before we do anything else, we're going to go ahead and listen. Alright, so I'm going to go ahead and listen for battle sounds into your artery. Light percussion and palpation. The percussion is when I hit my fingers like I did on your back. So we're first going to just feel lightly on all four areas of your belly here. Lightly felt, there's no masses or abnormalities there. I'm just palpating here for dullness, which I don't feel here, which could tell me that your splen's enlarged. So that's a good sign. It's not. We're going to do some deeper palpation here. No masses or abnormalities felt there. I'm just going to feel the femoral pulses here. 2 plus 4 and both femoral pulses. I'm feeling for now is your artery. I'm feeling the iliac, your aorta, and then the renal. And they all feel normal, plus 2, no abnormalities there. Also, while I was listening, I did listen for some bruits over those areas, and none were heard. What I'm going to do now is I'm just going to palpate for your spleen. So this can be a little uncomfortable at times. I'm going to go ahead and mark and measure. Or your liver, sorry. This is palpating for your liver here. I'm going to mark and measure the distance between those. We're at about 15 centimeters wide, which is normal. Alright, I'm going to try and palpate for your kidneys. Sometimes we can feel the very edge of those, but not too palpable, so we're good there. Alright, well that is it for the abdominal area there. We can go ahead and sit up again. And I'm going to have you the bottom musculoskeletal. What I'm going to do is I'm going to go ahead and have you lift your feet, roll them around your ankles like you did before. Your toes, bend your toes. Okay, your knees, move your knees. Perfect, wonderful. And I saw you walk your gaits nice and steady and normal. Just gonna lift this up here just to look. No abnormalities in the venous areas on these, no masses that I can see. I'm gonna go ahead and start palpating here. No abnormalities on palpation. Pulses 2 plus in lower extremities, dorsal pedis and gluteal. I'm going to go ahead and test your reflexes now, okay?
Okay.
Alright. I'm testing your arms here as well. I need you to relax your arm. Perfect. There you go. Alright. Go ahead and do the same with this arm. Perfect. All right, reflexes are +2. Wonderful, that's normal, as they should be. Now what I'm going to go ahead and do is to move on to sensation. We already tested all of your cranial nerves through our other tests, so what I'm going to do is just move on to sensation here. And I need the same thing. Close your eyes. I'm going to test your arms, your legs, and your lower back. Okay, you tell me dull or soft, like we did before, okay?
Mm-hmm.
Close your eyes.
Soft.
Where at?
Left arm. Right knee, leg, whatever. Soft. Soft left back. Sharp right arm. Sharp left arm. Sharp right leg. Sharp left back. Dull right arm. Dull left leg. Dull right back. Sharp left leg. Sharp right back.
Wonderful, sensations are intact. All right, DV, it seems we have completed our assessment. Is there any questions or concerns that you have at this moment?
No, ma'am, thank you.
All right, thank you.